Everybody, welcome to Therapy Corner. I'm Dr. Emelia. I'm a Yale-trained clinical psychologist, and today I wanted to talk to you about obsessive-compulsive disorder, or OCD. So what's a gold standard therapy treatment for OCD? Once again, it's CBT, cognitive behavioral therapy, but a very specific type of CBT that is called exposure and response prevention, or ERP. So ERP is based on the assumption of exposure, which is what we do for treatment of all anxiety disorders, which basically means that we help clients face those situations that make them particularly anxious. And the idea is that the more that people do this, the more they overcome their anxiety, the more they realize that they had played up anxiety in their head, that it's never as bad as they thought it would be, and that they're much better equipped to deal with it than they actually thought. So for OCD, it's a specific type because what we do is we expose our clients to situations that are likely to trigger intrusive thoughts or images or impulses, right? So we expose them to those unpleasant experiences that are full of anxiety, that are full of stress, that likely trigger the compulsions or of anything. It's about embracing uncertainty. And the more they do that, the more they're okay with that 0.1% or 1% or 10%, whatever the number is, the more comfortable they are with uncertainty, with not being able to be 100% sure of everything, the more power they take away from the intrusive thoughts. And the more they do so, the better equipped they are to deal with them when they come up. And so the goal of treatment is not to eliminate the intrusive thoughts, but it's actually to be able to take away their power when they do come up. And the more we do that, the less frequency they will begin to pop up, and the less anxiety we will feel. And then the less tempted we will be to engage in compulsions in the first place. But remember, because we do the exposure piece, when we do feel tempted to do the compulsions, we are equipped to begin to let go of that tendency. And that is how CBT treatment works for obsessive-compulsive disorder. If you suspect that you or someone else in your life has OCD or any other mental disorder for that matter, please consult with a mental health professional.
لا تنسوا الإعجاب بالفيديو والاشتراك في القناة.